finishing up our cardiovascular assessment. So assess all pulses. Radial pulse was one that I forgot, and it's just right here. Assess it for a full 60 seconds. Okay, and then I listened to the heart sounds. S1, S2 were heard. No pitches, gallops, or murmurs on auscultation. Now I can move to the pulmonary part of my test. So first you just want to look, make sure there's no lumps, bumps, or lesions. Hair is evenly distributed. Skin's warm, dry. And now you want to just assess the breathing effort, which is there's no breathing effort. He's sitting up straight, his posture's good. Also want to look at the chest. It's anterior to posterior. There's no barrel chest. Everything's symmetrical. Now you want to move down and palpate for tactile fremitus. So every time I put my hand on your chest, say 99.
99. 99.
Okay, just listening for the vibrations. And expansion is good and full. Now you can percuss the chest, so just percuss over the lung fields. Okay, and gonna listen to the breath sounds bilaterally to compare. Okay, breathe in and out. Alright, breath sounds are clear, no rales, rhoncos, or wheezes heard. And respirations are clear, smooth, even. Now we can move down to the abdomen. Normally you'll have the patient laying down flat in bed. And then the first thing you want to do is just look at him and make sure there's no obvious lumps, bumps, or lesions. Make sure hair is evenly distributed, no variation in skin color, no obvious pulsations, and it's non-distended, so that's good. Now you can listen, because you want to do that before you palpate or percuss. Listen in all 4 quadrants. Okay. Bowel sounds are hyperactive. Gurgling's heard in all 4 quadrants. Alright, and now you can percuss the abdomen in all 4 quadrants. Okay, and you want to palpate, do a light palpation to assess for any tenderness, and then you'll do a deeper palpation to assess for any organs that may be enlarged or protruding. Okay, so that's negative. Now you can move down to your musculoskeletal. So wiggle your fingers, roll your wrists, wiggle your toes, and roll your ankles, and then twist your elbows. Okay, that's good. And now you want to do your muscle strength test. So you're going to push against me, push down, okay, and push up, yeah, and then push against me, okay, good. And now we can do the neuro check. So you want to assess the cranial nerves. One of them is olfactory. That's cranial nerve number 1. You'll use a distinct smell to put in front of the patient, and they should be able to name it. So what's the smell?
It smells like coffee.
Okay. The second one you want to test is the optic nerve. You can just tell them to follow your finger, but don't move your head. So this way, this way. You can also test cranial nerve number 5, which is just the trigeminal nerve. So you'll clench your teeth and then just feel, make sure there's no tenderness. Alright, facial nerves, cranial nerve number 7. So you just look up and wrinkle your forehead. Forehead should wrinkle. Okay, that's good. The cranial nerve number 11, the accessory nerve, just shrug your shoulders, good. And then cranial nerve number 12, the hypoglossal, is just, you just stick your tongue out. Okay, that's good. And then we'll do the Romberg's test. So go ahead and stand up. Put your feet straight together, and then just close your eyes. And you'll just make sure they're not swaying, so everything's coordinated. So negative Romberg's test. So you can sit right now. Okay. And then you want to just make sure they have sensation to pain or touch. So we'll just touch them, make sure they feel it. All right, and then you can pinch them, and they should have some kind of response to pain. And then you want to do your deep tendon reflexes. You'll just hit the patella, and they should have a reflex. This one. Okay. Alright, and then the Brudzinski sign, you'll normally have them laying flat for this. It tests for meningitis. You just put their chin to their chest, and they should be able to go all the way down, so that's negative. Okay. And then the last thing is the tandem walking. So you go ahead and stand up, and then you want them to make sure they have their walk with their heel to toe, and they should be balanced, no dizziness or swaying back and forth.